Hello, my name is Nishita Patel, and I'm going to be discussing complementary therapies that will improve work performance for the nursing task force. So, complementary techniques are used to reduce stress and tension from the body. This helps promote concentration on relaxation, which will help calm emotions and increase the awareness of the health and well being. Some examples of complementary techniques are aromatherapy, guided imagery, journaling, music and art therapy, and meditation. So, as all of us know, being a nurse can be very stressful. We're maintaining and saving lives per shift, and we have many stressful tasks to complete within a time frame of either 8 or 12 hours. And many things can happen during a shift, such as a patient extremely sick, circling the hours of death, unstable acute patients, patients with psychiatric history, and poor staffing. All of these are considered stressors. Now imagine being exposed to this shift after shift without any time to relax and taking care of yourself. This will lead to burnout, and nurses will end up leaving because the stress is too much to handle. They lose their patience and compassion because they are tired. The purpose of this evidence-based practice is so I can help prevent nurse burnout and turnover rate. And more importantly, I want to help nurses do their job without the stress this job entails. I want to show them that therapy can improve their work performance and help them de-stress and relax during their shift. My evidence-based proposal question is: in a medical cardiology unit at St. Francis Hospital, will nurses who participate in complementary techniques state on a survey they have increased their work of knowledge of resilience strategies as opposed to those who do not choose to participate? And the outcome I expect to have is there will be increased knowledge of resilience strategies. The first research article that I read upon is about the effects of complementary therapy for hospitals that nurses exhibit high stress in. And basically, this article says that they had 5 groups in this study, a total of 98 nurses who participated. There was 4 interventional strategies such as relaxing music, electrical heat stimuli, aroma foot bathing, and muscle relaxation, and just resting in a bed as a control group. And it was found that the effectiveness of this therapy was measured by the pulse rate and blood pressure measurements along with the profile of mood states. And in conclusion, it was found that there were significant differences in pulse rate and mood state between the control group and groups that were participating in therapy, and confirmed that complementary therapies were useful and effective with nurses who exhibit high stress levels. My next article study design is nurses' attitudes towards the use of complementary and alternative therapies in critical care. So this was a qualitative research design, and this revolves around how nurses feel about this type of therapy being used. And there was a total of 348 critical care nurses from multiple hospitals that were recruited. And this survey was a questionnaire based, and the questions were basically about demographics, attitude and beliefs, knowledge and training, and complementary therapy use. And this study confirmed that nurses did not know many of the complementary therapies stated in the questionnaire, and nor did they find some therapies to be beneficial. So nurses basically do not have enough information about these therapies and aren't aware of the effectiveness of these therapies, and therefore if they're not aware, they're unlikely to do these therapies to help them de-stress and relax. This next research design is a quasi-experimental, which means there's a little bit of qualitative and quantitative data, and the objective of this study was to assess the stress levels of pre- and post-introduction of aromatherapy, which is a type of complementary therapy. So a pre-survey was given to a number of participants assessing stress levels, and then they implemented aromatherapy and then gave another survey after the aromatherapy. This continued for 24 hours a day over a 30-day time frame, and it was found that the pre-survey mean was 2.97, which means it was significantly higher than the post-survey mean, which was 2.70. So in conclusion, the fact that the pre-survey score was higher than the post-survey shows that the stress level decreased after they implemented the aromatherapy intervention. And this is another study, caring for caregivers, results of an extended 5-component stress reduction intervention, is a quasi-experimental research design, and again, this is both qualitative and quantitative data. And this article was basically about they were researching a program that was already in place at this institution to see if this program is actually effective or not. And so this program is called Caring for the Caregivers, and the variables being evaluated for its effectiveness are quality of life, complaints of stress and burnout, stress-related behaviors, and acceptance of the intervention. There was a total of 118 participants, 97 and controls. The researchers proposed a pre-intervention and post-intervention questionnaire, and this included scales such as the Maslow Burnout Inventory, Perceived Stress Scale, General Health Questionnaires, Job-Related Tension Index, Productivity Scale, Positive and Negative Effect Schedule, and the Visual Analog Scales. And the results after evaluating the pre-intervention and post-intervention scores concluded that the CZG program, which is Caring for the Caregivers, showed benefits on work quality by decrease in job-related tension and improvements on work productivity. So the intervention I want to set in place is I'm going to be using the nurses of a medical cardiology unit at St. Francis, which is the unit that I currently work on. And I'm going to be holding an in-service in the unit conference room during lunch times and morning huddle. That way I'm able to reach out to most of the staff twice a day. And the intervention for therapy will be guided imagery and meditation. A pre-survey will be administered to assess the stress levels before this intervention was in place. And then the next step will be implementing complementary therapy. I aim to use the complementary therapy beginning of shift during the morning huddle, and nurses will complete the second part of the therapy at home post-shift. Participants will be asked to record their feelings, their mood states, their stress levels until the study is completed, and the duration of the study will be for 30 days. The final step will be administering a post-survey to assess their stress levels after a consistent amount of therapy has conducted. The analysis of the data and the last step will be analyzing the data and finding a numerical deviation from the results of the perceived stress scale from the surveys and comparing the results pre-intervention and post-intervention. So how I'm going to be measuring the outcomes is by using the perceived stress scale to identify stress levels of the participant. And this is basically a questionnaire of 10 questions that will revolve around stress levels, and just general health questions as well. The higher the score equals the higher the stress. The subjective data is going to be gathered from the participants from their audio recordings post-shift complementary therapy session, and this is going to allow participants and others to hear the effects of complementary therapy versus just looking at numbers. This will have others listen to how they feel. Is it working for them? And if the scores of pre-implementation of the therapy are higher than post-implementation, that will conclude that the complementary therapy are effective in reducing stress levels, thus improving work performance, preventing burnout rate, and turnover rates. Some of the challenges and obstacles I face, I think, is will nurses commit to the study for 30 days? Will nurses have the time to take their scheduled breaks? Because if this is going to happen, then it's all based on when will they be able to do this complementary therapy. Will nurses want to share their feelings and stress levels that they feel at work with management? Because part of this study is going to be showing management that if this does work, it could be beneficial to other units, including ours, to implement a program hospital-wide for the stress reduction. Pushback from nurses who do not want change in their unit. I know there's nurses who've been there for a very long time who just like things the way they are. They have their order, and will they be open to allowing me to implement this new strategy and having them participate, even if it's for their well-being? Will management support new evidence-based practice to be initiated? Considering it's a hard time right now with COVID and going on, I know there's a lot of stuff already in play with management. This is more like adding something to their plate right now, although it might change down the road, hopefully, now that COVID is starting to, go away, so to speak. So it's more with them allowing me to hold this intervention, evidence-based practice on the unit. And will nurses be okay with using guided imagery and meditation for a choice of complementary techniques? And the other thing is the number of participants are in my study. I'd have to see if it's a small group, it's a small group, but the more participants I can get, the better results I can guarantee. So it's about how many nurses are willing to help me out and are willing to help find if this complementary therapy truly does help stress reduction and make a difference in a nurse's workflow during her shift. So how do I plan to distribute these findings? Is the findings will be summarized in a one-page summary, and I will distribute those findings to the participants. And since the evidence-based practice will be implemented on the unit I currently practice in, I want to be distributing a detailed summary about my findings to the practice manager and the senior clinical advisor. And I'm hoping if they find this evidence practice to be successful and do believe this will improve work performance in a long-term manner, I will be asking for their support in introducing this practice to other units. And if this practice is going to influence the Press-Ganey scores for the hospital on a unit basis, this practice, I'm hoping, could be made official somehow, which I'm sure I'll have to talk to my higher-ups about. And these are all my references for the articles that I've used. Please take a look at it. It's a great topic. I'm pretty passionate about it, and if this can make our lives better and less stressful, why not? So, thank you for listening.